Good afternoon, ladies and gentlemen. We already have more than 30 people with us. So we are going to honor everyone. Thank you for keeping time. And we will have to start. We hope this meeting will take 1 hour. If we stretch, then at least up to 1.5 hours, at most, not at least. Thank you everyone for coming. Thank you for logging in. I'm so happy that, first of all, I'm really thankful to God for life, that we are all alive and well. It's been a year that everyone has to remember, and I can't believe we are ending November, getting into December. I really thank God for that. Thank you for keeping time and for logging in. Those of you who don't know me, my name is Wako. I am a certified health and life coach, a member of ICF. I'm also a nutritionist and the CEO of KweraBITS, which is a nutritional company. We help people to try and eat healthy, to adopt a healthy lifestyle, do meal plans, help people lose weight, and those who are already sick, we help them to get plans that can improve their immune system, things like that. So that is KweraBITS for you. What we are doing today is Health Impact Bond, which happens every end of the month, and it is KweraBITS child. It's a baby, KweraBITS, and we started this because we wanted to work with people who take on a healthy lifestyle, because most of the time we all know what to do, but it is very hard to start. It is very hard to be consistent. It is very hard to execute the plans that we have. So Health Impact Bond helps us to meet monthly, communicate daily on our WhatsApp groups. We make the journey easy. We give you an accountability partner if you need one, because sometimes we are probably lazy to do some things. And it's basically a women's thing. KweraBITS is for everyone, but Health Impact Bond, the meetings we do are for the women mainly. And I'm happy to say that we have seen amazing results in the previous years and previous months. People have achieved good health, optimum body weight, and honestly, we cannot thank God enough. And also thank you for choosing to take on a healthy lifestyle and doing it the right way with KweraBITS help. Usually we always choose a topic and a challenge every month. And in this meeting, our topic is Dissecting COVID-19. Stroke, ask the doctor. We have a special person that will be introduced later by my co-host, Gladys Tugume. Gladys Tugume, please. We need to see you as I talk about you.
I'm here, Pirit.
That is Gladys Tugume. She's my sister, my co-host this afternoon. She's a registered pharmacist, a practicing program management specialist with over 15 years in strengthening Uganda's health systems. She's very passionate about client-centered care and approaches in health service delivery. And she knows that each person's journey is different and is unique. We are very happy and honored to have you this afternoon. And I'll be happy to request you to take on the next program and introduce our keynote speaker. Yeah, those who have the program, that is what is supposed to be next. Thank you so much, Gladys, and the people present.
Yeah, thank you very much, Purity. Thank you for the team that is here. I see we're already 37, which is a very good turn up to dissect COVID-19. I know all of us are either affected or some of us have gone through the experience. So some of us are fearing that we could be the next ones to get COVID. So we want to listen and get as much information as we can. As Purity has said, I am Gladys Tugume. I'm a registered pharmacist, but currently doing program management, but very interested and passionate about people and how they are managed in the health system that we all access. My duty today is to introduce Dr. Michael Muzoora. Muzoora is trained in Makerere University. I know we have some doctors here. He did his MBCHB or medical school, undergraduate in Makerere University, and later on proceeded to do residency in internal medicine. He is a pulmonologist with specialization in critical care. So for those among us that have been in ICU, we have had a few of us that have gone to ICU. You'd probably have been Dr. Michael's client. So he will be speaking to us and going through a series of questions that we have raised as a group. We did get about 23 questions, which we have clustered into either treatment for COVID or after COVID treatment, that is recovery phase. And the other part is prevention. So we shall ask maybe 2 or 3 additional questions in case what we wanted to listen to has not been ably covered. On the call, we also expect a doctor who is one of us that has actually gone through this experience to just briefly tell us about recovery, because many questions came around recovery phase. So I don't know, Purity, if I should go ahead and start us off, or if we should first listen in from Dr. Michael to give us a preamble about COVID-19 and about himself before we tackle the different questions that may not be addressed from the short discussion that he will give us. Over to you, Dr. Michael, for that.
Good afternoon to you all. It's nice to be on this forum and good to interact with all of you about this topic that has become quite a challenge to everyone in every corner of the globe. As introduced, I'm Dr. Michael Muzoora. Grew up in Uganda, practiced in Uganda. Now I practice pulmonary and critical care, and pulmonary pretty much being chest medicine. So I'm just going to talk briefly about COVID, what we know about COVID in just a few words here. So then at least we have some background, and then we can go on to the questions, just as Gladys and Purity have mentioned. So the history of COVID. So what we know about COVID is really it came to be around December of 2019 in China, and it turns out to be a coronavirus, as is widely known. And this coronavirus, as it is described, is the so-called novel coronavirus, which means that it is new to all of us. Really, that's all that word means, is that the human body has never interacted, has never experienced this kind of virus. So there is no one who has an immunity towards this virus up to now. So that's why it becomes a big challenge. But we also know that it is slightly similar to 2 previous coronaviruses that kind of circulated at different times. In 2014, there was one which was in the Middle East that was called Middle East respiratory virus. And there was another one that goes by almost a close name that was SARS-CoV-1 in 2002. And that's what is much known about this virus, other than there's been some people who really worked hard on trying to really make it more describe it a bit more at length. So how does it move from one person to another person would be another big question to look at. We know that initially when this was looked at, it was thought to come from some sort of animal, in this case, the bat, and then it moved into human beings. And then now for us, on a practical sense, how are we looking at coronavirus? So we think primarily it does, excuse me, it does affect the lungs. So it's going to spread through what are called aerosols, pretty much. It means that if you cough, it moves from one person to another person. And at the beginning, that was what drove a lot of how everyone felt about it was mostly by coughing. But then over time, it's been shown that it seems to spread even when someone is talking. If someone is close to you and they are simply talking and they don't have any symptoms, this virus can still spread. Or if someone is singing, even someone laughing. So the virus does seem to have various ways it spreads, but it also seems to spread from one surface to another surface if you touch a surface. So if I have an infection and I cough in my hands and I'm opening, I'm opening a door and I touch the door, I leave the virus there, it can survive there for a variable amount of time, which is depending on the temperature situation. It's been shown that if it's very warm, you can have it, let's say, on a metallic surface for close to 1.5 days, or a plastic surface for longer than that. But in warmer environments, it tends to survive maybe about 1.5 days. In very cool environments, it can survive up to 3 days. And if you touch that surface and you touch your face, your mouth, it's likely that you can spread that. You can contract it rather. So that's sort of how it's been shown to move from one person to another person. And it seems to spread much faster than you would for other viruses that are similar to it. For any one person that seems to have this virus, it seems to infect, that one person can infect many more people compared to other viruses as known, which may infect maybe 1 or 2 people. But then you find that this virus, actually, one person can infect up to 3 people, which is more than what other viruses have been able to. So looking at how it spreads, that basically brought in how do you protect yourself from catching the virus, and hence the commonly recommended strategies for control. Keep far away from people, which is social distancing, and that all has to do with the more space you give yourself from another person, those particles probably won't reach you. Wear a mask. This was something that caused a bit of a challenge in many places, especially here, because at the beginning, the general thought was, well, you didn't need to wear a mask unless you were in a hospital and were going to be around people who are sick. But like I mentioned, now that there's a understanding that actually people who are just talking can spread the virus, it's also been shown that if you wear a mask, whether it is a surgical mask or even a simple cloth mask, it seems to reduce the chance of you picking it up from the other person and even you passing it on to another person. Limiting how many people you are around, because it seems if you're in larger crowds, of course, there's going to be more concentration of people. Being in tight spaces, indoors seems to be, there's a much easier spread when you're always crowded indoors versus if you're outdoors in an open field. And we tend to see that in a place like here where we are, where we find that as it cools down and people have to be more in a closed, cold environment, then it seems like the rates go higher and higher. And when it's a warmer climate and people are mostly outdoors, there seems to be less spread. So those are sort of what you look at as the control measures that are working if you're trying to protect yourself. And so how about people that have acquired the virus? How do they tend to present? Now, this has been one of another difficult way to describe, because the presentation is very variable, and that I've also seen in my experience looking, caring for different people is, so cough is a commonly described symptom, but you find it in maybe about 5.5 to 6 out of 10 people that have the virus. So there will be more than 4 people who have the virus and don't cough. Fever is another common presenting symptom, but also it doesn't go any more than maybe 6.5 out of 10 people. Flu-like, or basically I have nasal congestion-like symptoms. That is also a described symptom, but that's probably about 5.5 out of 10 people will have that. Surprisingly, it has appeared that the virus affects sense of smell and how food tastes. And you actually find more people that describe that. And in one of the papers describing this, it was almost up to 7 out of 10 people described a change in how something tastes or smells. And then some just non-specific weakness and fatigue. Then a few people will simply present without any of those, and they're just having some sort of disruption, something similar to diarrhea or no diarrhea, or even nausea, feeling like they are going to vomit. So the presentation is very variable. So what are the systems that tend to be affected the most? By far, the breathing system or the respiratory system has been touched on the most, and it's the one that seems to be most affected, which is most people will present with some form of shortness of breath, and then they will, if it involves the respiratory system more, they may need oxygen and support for the oxygen system, or what's called COVID, you develop COVID-associated pneumonia. But overall, COVID does affect any part of your body. It will affect your muscles. People feel extremely weak. It will cause a lot of diarrhea and nausea. Some people just present with so much diarrhea, it can affect the liver. Then you find that the liver is not functioning well. It's also known to affect the brain now. There's a lot of research that shows that the brain gets affected in many ways, and it does affect the heart a lot. There's so much presentation with involving the heart. Time from when you look at what's the average time that seems to be from when you actually acquire the virus to when you may develop symptoms, seems to be close to about 5, maybe 5.5 days. And your body responding and actually starting to protect itself seems to be anywhere about 7 to 14 days. So that's when most people will start to recover, about 14 days, but the recovery time is actually variable. Some people take longer. And that's sort of what is around COVID. What makes some people at a bigger risk and what makes some people at a lower risk? That is also something that is a subject to research a lot that hasn't been answered very clearly, but certainly what's been observed to date in the about 1 year that we dealt with COVID is younger people tend to do better. As we get older, older people tend to do worse. And the thought seems to be centered again that since this is something that no human body has ever encountered, it means that our immune systems respond differently. So younger people tend to have a much healthier immune system compared to when we get older. And that could lend credence to why young people tend to do much better and don't tend to have as much symptoms compared to older people, is that young people have a more robust immune system. But then there are also various diseases that tend to keep creeping up as we get older and have been shown to have a lot of association with the disease being a bit more severe, and that is high blood pressure seems to be a problem. Diabetes seems to be a problem in increasing the severity of the disease. Of course, if you have any form of other lung problem going on, it tends to add to the challenge, because if the disease affects the lungs and you have an underlying lung problem, that becomes a challenge. If your immunity is affected by one thing or the other, certainly your immune system is going to be slow to respond, and that does create a challenge on how you recover. And if you have some underlying problem with the heart, that too has tended to be a challenge for people and has raised the risk. So those are the people that are recommended. Even take extra precaution if you have any one of those things. So I think that's what I'm going to talk about for now, as far as the treatment and what are the chances that someone can get reinfected. I think there are maybe questions on that, and I'll just let us handle that as those questions come up. So that's what I'm going to say for now, and just going to let Gladys and Purity run the questions.
Okay, so thank you very much, Michael, and we'll just go ahead and start the question. So on the treatment side, we had a couple of questions. So the team has heard of the use of vitamin C and azithromycin. What is the dosage as it's used in, is it used in the normal dose? How self-medication that is circulating on social media? So just to let you know that in Uganda here, we have almost on a daily, there's someone posting on what medicine they have used and what seems to work. So would you recommend self-medication? Maybe I will just run through, you will also need to talk about vaccine safety and if we should expect that very soon. What medicines are you using to treat COVID-19 in the US? What's your take on vitamin C 1,000 milligrams and zinc 50 in acting as an immune booster? But what can we also use to boost the immunity for school-going children? And is it true that actually inhaling steam kills the virus? So if you just speak to self-medication, vitamin C in high doses, and zinc and azithromycin, and then the vaccine.
Okay. So the treatment for COVID, so vitamin C. Now, vitamin C didn't just come up as an immune booster in COVID. It has actually been highly investigated over the last 2 to 3 years, and it first came up strongly as a treatment in a condition called sepsis. Now, sepsis is just simply a condition which arises when your body is trying to respond to any form of infection. It can be anything arising out of anywhere, but then it doesn't do it in a coordinated fashion, and instead it damages itself. And the body can damage itself very extensively, that it can destroy itself as it tries to attack any other kind of offending agent. And what was thought is, in those states, there actually seems to be that your body is depleted in a key component, like someone who is lacking vitamin C, and someone thought that replacing vitamin C would be a key part of people recovering from that severe form of a disease state. And initially it was shown to work a lot, and everyone started using it. And then later on, a lot of research was done, and it was shown it doesn't do anything. But vitamin C is fairly cheap and is very safe. And you can use it at any dose. It's not going to be harmful, because your body will take what it wants and it will not absorb what it doesn't want. So if you take a lot of vitamin C and your body doesn't need it, it just won't absorb it. So it can't be harmful. So 1,000 milligrams has widely been used, and it is okay. So then it resurfaced in COVID, and actually it resurfaced under the very same person who has been using vitamin C from the very beginning. The same doctor, the same university that started this research, there's one doctor that's involved in this management. He has been so big about vitamin C. I've read so much of what he has written. He's the one who brought it back up in COVID and it spread everywhere. There's no straightforward answer to say it will work certainly or it won't work, but it's cheap and it's okay. Zinc really has not had anything behind it that I'm aware of. It's been spoken of by many different doctors, and people just simply use zinc. Zinc is an element that is also incorporated in the immune system. I'm not aware of any very strong research that you can use for zinc, but it's also not harmful if one wants to take it. So when someone asks me, when a patient asks me, they say they want to take zinc, it's fine. Vitamin C has more stronger data with it, but it goes up and down. There hasn't been something consistent, but we have used vitamin C a lot. It comes and goes. So that's with vitamin C and zinc. As far as azithromycin is a known antibiotic. So azithromycin has been around for forever. You know, it's known to treat regular bacteria that cause infections, whether in the lung, you know, or in the nose, or ear infections, or nasal infections, or chest infections. So it does work on bacteria. Azithromycin doesn't have any activity against any virus, and its most common use in COVID has been for management of other bacterial infections that can arise. So if someone comes in and someone is not sure whether this is only just COVID or maybe they have another infection, azithromycin has been used. But as far as for treating COVID, no, it doesn't have any activity against COVID per se. And that also has been looked at many times and shown not to do anything. It has no effect completely. So azithromycin is the same as the hydroxychloroquine. Those two drugs have been shown to have zero effect against COVID. They have no benefit at all. But azithromycin itself is still used a lot because of other bacterial infections, and it's a good antibiotic to treat many bacteria. So it still has a strong effect on that stuff from that standpoint. So you'll find that many doctors will use it because it still does, you know, they are concerned about presence of other bacterial infections. So using azithromycin is appropriate, not primarily for COVID, but for other bacterial infections that may be at play. As far as using steam, no, that's all I can say about it. That's actually very hazardous to you. You should not try that. You should not try to inhale anything that is at a high temperature into your lungs. So, and there's no way you're going to inhale anything like steam that's going to kill a virus in your lungs. So that would not be very good for you. As far as building immunity for children, now this will, you know, come back to what Purity does, which is nutrition. Now, what is being understood more as we learn how the body defends itself against COVID is similar to any other virus. Actually, is that your first response to the virus, there's something that's called your innate immune system, which is your body has its defenses already set. They are the first line of defense against COVID, you know, when someone gets affected. And then there's the other part which comes in where your body has to produce antibodies, and then there are other cells that come in to attack the virus. And that's why the process takes time. So we know that the healthier your immune system is, the better you're going to be. And nutrition, so for children, good nutrition, healthier nutrition that has a lot of fruits and vegetables is what improves a lot of nutrition. That's been So that's not new, that's applicable to any situation. That healthier diet that is very high in fruit and vegetables does boost the immune system a lot. And then frequent hand washing. So those are the protective mechanisms for children that are going to school. Hand washing, sanitizing when they can, and many places still recommend wearing masks. That gets a challenge in schools, but that's one way to protect children in schools, remind them about hand washing and limiting group playing and everything. Those are the strategies to help children who are in school. I think the last bit was on what treatments are available for treating COVID, in the US and other places. So COVID per se is not, so it is a virus, so there is no known cure so far. There is no definitive cure for COVID that is available. There is only one drug that is approved for treating COVID as an antiviral drug per se, and it's a drug that goes by the name remdesivir. Remdesivir is, so COVID is, in its basic sense, is called an RNA virus. That's just a part of how it replicates or what it's called. The others would be called DNA viruses, but this is an RNA virus. And this drug remdesivir targets COVID to reduce its replication. It's being widely used right now, and it was used under an emergency authorization. They did have some strong paper about 3-4 months ago, where they showed that patients who got their drug, remdesivir, seem to have a quicker time to recovery. And based on that, it did get a quick approval on its use. So it showed that people who were getting sicker and started to need oxygen and were needing less amount of oxygen, if they were given remdesivir, they tended to recover quicker than those who were not. So remdesivir is the one drug that's available. Dexamethasone, which is a steroid that's been around for forever, also had some very strong study, a British study before. The British were the first to use it, and they showed that a dose of 6 milligrams taken daily for 10 days, mostly for patients who are beginning to need oxygen and who are getting to more past the mild to moderate phase of COVID, also did well. So use of remdesivir, rather dexamethasone, seems to have much stronger effect even than remdesivir itself. Boosting someone's immune system is something that's been looked at mostly from antibodies. So there's been wide use of plasma, basically, which is a blood component from other people that have recovered from COVID. That's been, it had some information behind it about 2-3 months ago that it was useful, but surprisingly, as of this week in New England Journal of Medicine, all the follow-up studies show it doesn't work. There was no difference. It didn't do anything, and that seemed to do with, you can't tell from one person to another how much of the antibodies they have. So my suspicion is that may start to fall to the wayside, just like hydroxychloroquine shot on the stage and then was found to not work and actually be quite harmful to patients in some ways. And it kind of has fallen off completely. It's not used anymore. There has been one other designed antibody that honestly just came on the market about 2 weeks ago, 2-3 weeks ago. That hasn't been widely circulated, but those people have also not released their actual research on how it worked. But it has quickly jumped on the stage and it's being used a whole lot. It seems to take up for people who are not in the hospital and are beginning to develop COVID symptoms. That's the target group they have. So those are the drugs that are available for treating COVID. Remdesivir, dexamethasone seems to work the best, then remdesivir, and then trying to give someone antibodies. Initially was giving people plasma from people who have recovered, and now there is a lab developed antibody, or otherwise as they are referred to, monoclonal antibodies have come on the market. So those are the 4 targets so far for treating COVID. Stretching into vaccines, yes, vaccines have now hit. All the 4 companies that were looking at vaccines have all reported that their vaccines are very effective in very interesting numbers. So the vaccines are coming onto the market, and everyone hopes that they are going to be really the magic bullet. Hopefully they will be. And they are 3 different vaccines produced by 3 different companies. AstraZeneca, Pfizer, and Moderna have all released vaccines that they're all made in different ways. 2 of them are using a much newer technique for making vaccines. They are not made in the way we used to think of vaccines. Previously, we used to think of a vaccine, let's say, the polio vaccine or measles vaccine. You get the organism, you either kill it or you inactivate it, and then you inject it in someone, and then someone develops an immune response, which becomes protective. These all new vaccines are made a bit differently. It's basically you trick your own body to make something that is similar to the virus, and then similar to a component of the virus, and then your body develops an immune response. So it's a completely newer technique, and it's been fast-tracked. But these 2 have not yet published how well their work works. Rather, they are research to see what's the effect of these vaccines, but they are being fast-tracked, and they are hoping to be up for use within the next 1 to 2 months, actually. All right, so that's what I have on the treatments.
So thanks, Michael. I just want you to touch one thing briefly again. People have been inhaling steam, and you've just said it's not good to inhale the steam. But I want you to differentiate inhaling steam from our normal chogero or aromatherapy that we have always used back home for when you have Ruviamida or what. Are you speaking of the same? Is that also bad where they cook many herbs or the leaves and cover someone to get that aromatherapy? Or are we talking about just water boiling and someone steaming themselves up? And you didn't say whether you recommend self-medication. If someone has symptoms, whether they can go ahead and self-medicate.
So the quick one on okay, let me start with the first one. Aromatherapy. So aromatherapy, the idea which our grandparents raised us on aromatherapy and our parents is a whole different idea. It's mostly what you're inhaling is something that has a soothing effect, has a soothing effect on the body. So eventually, so there's where you have a lot of secretions. So if you have flu in the body and you're having difficulty coughing, that's what our grandparents and parents used aromatherapy, or for, is just to help. It's at a lower temperature, you're inhaling something that has different aroma or smell or whatever word you want to give it, that just allows you to produce secretion so you can cough up much easier. So that's a whole different strategy, and that's okay. That won't cause you any harm. If you're thinking of inhaling, and the idea was never to kill anything, it was to allow you to breathe easier so you can have all these secretions, all the you're having difficult time coughing so that it comes up. Using steam, that's a whole different strategy. Strategy is, remember, if you're using steam as in boiling water, that's above water. When it vaporizes, it's above 100 degrees. And that's highly corrosive. You can burn your airway. That is not recommended. So that's what I meant. The aromatherapy, where people put different leaves, you know, and you bent over and covered yourself, that mostly was geared towards helping you cough up the thick secretions that are just, you're having difficulty coughing up because you had some sort of congestion in your nose. Your nose is so congested and blocked, and you wanted to open up the passages by allowing, you know, all the dried up secretions to come up. And those, it works, it's okay. And that's why it's done at a lower temperature, but not inhaling boiling boiling water. That's the steam from boiling water, because when it vaporizes, it can be very dangerous. Self-medication. The question is, what are you self-medicating with? And you have to watch self-medication, because if you're self-medicating with vitamin C, I can't see there won't be any harm from vitamin C. Vitamin C is fairly benign, honestly. It's a vitamin, like I said, you can't overdose on vitamins, at least not vitamin C. I mean, you can overdose on vitamin A and things like that, but vitamin C, if you take a lot of it, your body will get rid of it. The dosage for zinc varies from anything from 200 milligrams to 400 milligrams to some people using 1,000 milligrams. It's very hard to come by anything that has elemental zinc up to 1,000 milligrams. 200 milligrams. And as well, if you're swallowing it, if your body doesn't need zinc, it won't absorb it. So yes, if you're self-medicating with vitamins, some of these nutritional supplements, yes, that is fine. There's no harm in that, because your body regulates how it takes those in and how it puts them out.
Thank you very much. And yeah, that was helpful. I think that's good. So the last final part on treatment is vitamin D3. Any dosage, is it helpful? Someone has just posted a quick question on vitamin D3. Your take on its benefits in COVID. And we must move because our time is fast spent.
Vitamin D, again, is another one that has been looked at for various disease states, but not particularly for COVID. Dosages for vitamin D supplementation tend to be in the range of almost 50,000 units to 100,000 units, something like that. Vitamin D, there's really, I can't say yes or no about COVID. It has no particular application for COVID, but I also have to say that vitamin D was looked at initially for what I described as sepsis, which can arise from anything, including COVID. COVID can cause sepsis, and vitamin D was shown not to do anything. It didn't change anything, but it certainly can't harm you. But, you know, there's really plenty of sun in Uganda that I'm not sure that anyone is going to be short on vitamin D. You know, you just need to go in the sun, you'll have enough vitamin D.
Okay, so thank you, Michael. And just also mention for the people asking about vitamin D is that our labs in Uganda are equipped to check your vitamin D3 levels. So if you just go to Lancet Labs or Ebenezer Labs, they'll just get to tell you if you're in very good ranges and if you need to supplement. So maybe for that, you don't need to self-medicate. So we'll move on. We are now going in after COVID-19 treatment. We can't finish everything within the time. So someone brought in a question, how come I still have all the symptoms, yet I was discharged and tested negative 2 weeks ago? My breathing is still bad, pneumonia did not go, body aches, headaches, chest pain, etc. What are the after effects of COVID-19? Any advice on post-COVID recovery? So on this note, just before Michael comes in from the medical perspective, I want to invite a friend. He's called Dr. Hilary. He has gone through a similar experience. He is working, he's trained in Uganda, he's working in Uganda, and he has been through the first hand of what this question is talking about. So Dr. Hilary, I would want you to just introduce yourself, and I give you 3 minutes to speak to us about this and possibly another question that I will ask later. Over to you, Dr. Hilary, for a moment as Michael takes a break.
Yes, again, my name is Hilary Alima, doctor, trained in Uganda, working in Uganda. Just in the 3 minutes that I've been given, I am a survivor of COVID-19. I was working in northern Uganda at the time when most of the numbers were coming through a Legu border, and I got diagnosed with COVID-19. Now, there's so much I can talk about the experience, and Michael, thank you so much for the very insightful talk that you've given us. But I just want to go straight to the question that was asked about the symptoms. My experience was, I think, similar. When I was confirmed, first of all, the first thing I realized, as Michael mentioned, my first index of suspicion came in when my sense of smell changed. I didn't have much symptoms then. I've had allergies on and off, and so that was not an issue to me. But when I couldn't smell, I got some perfume sprayed on my hand and I couldn't smell that. I knew this is COVID. And so I went and got myself tested and then checked myself in Malago Ward 6B. I drove myself there. So just going to the discharge time from the question that came in. Unfortunately, I don't remember the name of the lady that asked. Symptoms, I think, kind of lasted a little longer. People have different experiences. I've had talked to a number of people, but people have different experiences. And I think Michael mentioned something very critical. The other comorbidities that you had prior to that, I think, are critical for them, for people. I had had my blood pressure go up. Earlier on, and was managed, with exercise. One of the first things that went up above 160, 110. The coughing, anterior chest pain, lower. But when I was discharged, at the time I was discharged, I'd gotten about 3 tests negative, but I still had the chest pain. It was not as strong as it was before. I could lie down because prior to that, I could not lie flat. I was doing some exercise to kind of get myself breathing because it was a bit difficult, but I had some symptoms. Then I also got a few strange symptoms. I think that was body swelling. I remember I got global body swelling. I couldn't understand that. And as a medical person, I couldn't even connect that to COVID-19. The congestion continued. I went and I got examined. They did full body check, organs, blood, x-rays, lots of tests. And at that time, the tests actually looked normal findings, but the symptoms were actually there. It was so strange. The physician looked at the x-ray and said, the x-ray looks perfect. But I was still feeling, that anterior chest pain. I had it for about probably 4 weeks post-discharge. And a little coughing, definitely that was a little stigmatizing. If you've been discharged and they've said you're cured and you're coughing, everybody's thinking, aren't you still transmitting? So you don't want, the advice was initially stay home, 2 weeks, 3 weeks. People at home will know you've been discharged, but other people may not understand. But yes, the symptoms do sometimes go a little longer. I know some people I was with who never got any symptoms at all. And then there are those who got so worse off. They were put on oxygen. At the time, I think oxygen was difficult to get. We were sharing, and so I couldn't get, but yeah, it was, the symptoms were even heavy at the time of discharge. But after about a month or so, they started to go down. The swelling of the feet, the body came down, the coughing came down, and I felt the muscle pain come down, and then I felt better probably a month and a week, probably about 5-6 weeks. Yeah, Gladys, I hope that is helpful. I know I can say much more, but
Yes,
just
thank you.
to give a picture.
You've done good justice. So Michael, do you want to wrap that up?
Yes, thanks, doctor. It's what you described is definitely been noticed a lot in COVID. So the recovery time. So there is this part that COVID itself, your body clears it, but one of the things that I noticed is COVID, if you evaluate patients who have COVID, it does affect muscle fibers a lot. And actually, when you have patients in hospital and keep measuring their muscle enzymes, you'll see them go up, meaning there's a lot of muscle breakdown. And one of the most noted symptom up front was there is extreme weakness. And some people just even get so weak to the point they can't stand. Others, it's variable. There's so much muscle breakdown. So there's a lot of residual weakness even after you clear COVID. There are patients that get weak for a long time. And that duration goes anywhere from, it can go 6 to 8 weeks before the muscle fatigue just goes away. Now, the lung itself, COVID is one of those diseases that has been very interesting. When you look at an X-ray for someone who has COVID pneumonia, it's a prototypical X-ray. It doesn't look like any other common X-rays we have seen before. But there can be so much inflammation in the lungs that can take about 8 weeks to resolve. So you have this combination of the still post effects from inflammation in the lung as well as muscle weakness. You just kind of feel more short of breath and you're still weaker. Now, lung recovery takes a while. The way you should think about your lungs is the way you think about your skin. What happens outside on your body is exactly the way the inside of your body heals. If all of a sudden you burn your skin, you'll have a lot of buildup or what's called a blister. There's a lot of oozing, then that will break down, and then that will start to heal. But even as it heals, the skin doesn't look the same as the rest of the skin. It will look different, and then eventually it will start to look like the rest of the skin. And that's the way the inside of the lung appears. The initial part is there's a lot of fluid buildup, and then that starts to go down, and then there's some sort of image that looks like a scarring pattern, and then the lung starts to heal itself as the cells reorganize the lung. And that's how it's going to take phases. And that phase can take up to 8 weeks for some people. And then some people have very minimal lung involvement and won't see that. And because COVID does affect the liver a lot, it's one organ that gets affected, and you see people's liver enzymes shoot up because of COVID, and then they come back down. That sort of affects how you eat. COVID has a lot of effect on the brain, so people just kind of remain very tired. And some people have a hard time with focus after having COVID because of all of that. And it takes a while depending on how severe that was. So that's what affects the recovery time, is just that the virus itself goes away, but because it can affect several organ systems and yes, the heart, it does attack the muscle fibers of the heart. And in extreme circumstances, it does cause a reduction in the function of the heart. We see that a lot. Patients come in with normal heart function and the function of the heart drops off because of COVID, because you do have effect on the heart itself. And that's been one of the cautions in young people who are very highly active, that you need to make sure that their heart is fine after COVID. So those are the effects and the recovery time. But most people after about 6 to 8 weeks recover completely and they are fine. Now, do we know if there's going to be any long-term impact 1 year down the road, that is still being looked at.
Okay, so Purity, I'll ask you to take some questions.
Thank you so much. Thank you so much, Dr. Michael and Dr. Hilary. There's so much to learn, so much to discover. In the interest of time, I'll read about 5 questions that go, and maybe you can combine all of them and find a way to answer each. Dr. Michael, someone asks, and this is their question: what are the other remedies for total recovery for someone that tested COVID-19 positive and finished the medical treatment? The other question is, are there proven COVID reinfections after recovery? When should one go back for retesting? Advice on nursing techniques by the home people. Another question: how is it possible that one part of the couple sharing a bed can be positive for COVID and the other negative? And I'll read the last question. When is the right time to seek medical attention in case one suspects to have contracted COVID-19? Over to you, Dr. Michael.
Okay, thank you. So I'll kind of go through these quickly. Remedies after you've recovered from COVID, it's going to center around nutrition, and gradually improving your exercise level. Why is nutrition key? Is almost all your immune system recovery is based on how nutrition built up you are. And depending on if you have significant COVID infection, your nutritional level goes down very rapidly. Most of these patients, if you measure their protein level, it starts to go down very abruptly because most of these patients have difficulty eating. Like Dr. Hilary mentioned, you don't have any sense of smell, sense of taste. That drops off how much you're eating, and most of us underestimate how much we're eating. So being able to maintain a healthy diet and eat regularly and try to gradually exercise, not intensely, but do more and more so your body gets stronger and stronger. It's not based on any medicine that you can take. There's no medicine you can take to build that up. It's mostly just getting yourself back by making sure you're eating a healthy diet and you're gradually getting your activity back up. Reinfections, there's only been 1 or 2 published information about cases of reinfections, and most of those were in China. And that's still a subject to question, is this reinfection? Was there some change in the virus that someone gets reinfected? But otherwise, cases of reinfection are not yet very well documented. What is known is how long does the protection you get from having COVID last? Somewhere around 90 days, your antibodies may start to go down, but that doesn't mean that the other protective mechanism that the body uses, let's say from a virus, from immunization standpoint, are not there. So reinfection with COVID is still not very well documented, but there have been some few published cases of patients that were reported to have had reinfection, and the virus was looked at and it was shown to be a reinfection. It wasn't the same one that the patient had before, but those cases are far and wide. So answering that question definitively is actually problematic because there is just not clarity on how this works. Someone has an immune system, they have built immunity, which starts to wane off over time. Looking at the other viruses that I talked about, which was the Middle East and the SARS-CoV-1 from 2002, actually, it showed that some people still had a good immune system up to about 1 to 2 years out. So this question on COVID is still out there. It's not fully answered, but yes, most people for about 90 days are very well protected for sure. Retesting, this has also become a subject of contention, and as of now, at least the CDC is beginning to move away from retesting based on, even after you get well, surprisingly, you do have some level of what's called viral shedding. So if someone gets a very good swab from your nails up, they can actually find 1 or 2 particles of the virus. And does that mean that you're infectious? That's very unclear. But if you wanted to retest, minimum of not less than 14 days, because at least that's the time that it takes to have your immune system build up. And until your immune system builds up, the amount of virus in the body won't start to drop. So 14 days is a good time to retest. Most people will go out to 28 days for retesting. Nursing, home care, that needs a lot. You should use standard precautions. Make sure you're always wearing a mask and a face shield with gloves and frequent hand washing before you put on and off gloves. That's the one thing. The question as to why one couple gets infected and the other one doesn't get infected is one that is very difficult to answer, and it's just not very clear. What I've seen clearly is both couples the couple gets infected, but they display different symptoms. One may have more significant symptoms and one barely has any symptoms. And that mostly has to do with, again, how the immune system responds. But I really don't have an answer as to why, in the couple, one tests positive and one tests negative. I've almost not really encountered that. I have seen almost all my patients that I take care of. It's just that one displays more significant symptoms and one doesn't. But by and large, almost everyone, if they're always in close proximity, invariably they both get infected. But one may have, a higher fever and one has 0 symptoms, just maybe feels a bit of some weakness, but nothing. I think those were the questions, right?
Right. I think there was one on when should someone seek medical attention in case they suspect that they have contracted COVID-19.
So here is, if you suspect that you've contracted COVID-19, the recommendations, and I think that's what the Ministry of Health still recommend, you should quarantine yourself. If you're not having any symptoms, you don't really need to seek any medical attention because the answer is going to be the same. You should stay home and quarantine yourself. If you start to develop high fevers, cough, and you feel short of breath, that's a good time to seek medical attention. If fever is going up, you're starting to cough. But if all you're having is, like Dr. Hillary mentioned, is some bit of change in smell and taste, and you're still able to eat and you're strong, it will not, most likely seeking medical attention will not change anything that you do. The guideline is still just supportive management, stay home, try to eat healthy, and quarantine yourself. Desist from, you can take your vitamin C if you want to. As I mentioned, it's very hard to say a plus or minus against that. Zinc, fine. Hydroxychloroquine is one drug that everyone should stay away from. That drug has been researched more than any other drug on COVID, and it has not worked in any scenario for prevention, for limiting symptoms, for treating more severe symptoms. The drug has had, even as of yesterday's publication of the New England Journal of Medicine, again, it was another paper on looking at hydroxychloroquine in various ways. The drug just does not work. So that would not be, it would not help much. So yeah, that's what, if you feel like you are getting a bit, symptoms are progressing, then yes, you should seek medical attention.
So thank you, Hillary. Hillary, if you can just speak to us on what it means to self-isolate from home. I think people are wondering, how do they isolate themselves when they have family members? Do the other family members have to leave? But I know Dr. Michael has talked a bit on that, on how you can actually have preventive measures. But how can we effectively self-isolate at home? And then how safe is it to interact with former COVID patients? Michael, you will have to answer to that. Hillary, just speak on how you manage.
Okay, thank you. Thank you, Gladys. Self-isolation at home, I must say, is difficult. I think that's why most people have preferred to leave their homes. I did it at home as I waited for that time for results. With the adults, it's easy. One of the things I did was to communicate, not only with my spouse, but all the children, and just let them know what is happening, why I think I might have COVID-19, and then to tell so they understand your behavior, especially the children. The young boy, it was hard even after explaining for him to keep away. But once you explain to them, definitely they get worried. But I let them know why I must be away from them, because I'm at home in a room. And my wife, who supported me, would mask and then bring me meals and things like that. But it is tough, but can be done if you have to do it. Because at the end of the day, I think it paid off for me. I can't be too sure, but I think because despite having been with my family earlier, all my family turned out negative. I was the only one who was positive, but it is possible, but you must communicate to your family members about what is going on. And unlike what people think, I think there is a lot of stigma related to COVID-19. It's probably coming down as the numbers become more and more and people begin to talk about it more. But at the time, that was late July, at the time, there was a lot of stigma about COVID-19. So even then, I told them not to, I told them close the businesses. You're not going to work today. You're not going to school or anywhere. They should stay at home for the safety of others. And also because people may contract COVID elsewhere, but they will probably attach it to you. And you don't know how violent or how people respond to this. So I asked my family to stay indoor while I also stayed in one section of the house until the time when the results came out. Then I came out and I told them, like I mentioned to you earlier, there was a possibility and the result has come out and I'm positive. I must say at that time, it was one of the toughest things because they looked at me as though it was a burial day for me. I could look at their faces, so I had to talk to them a little. Then I decided I would drive myself and take myself to hospital alone. So we're not having anybody else being kept elsewhere. But yes, it can be done, but you have got to communicate to the family. Yes,
Thank you,
Gladys.
Hillary. Thank you, Hillary, and apologies for all of us that have actually built up that stigma. So, Dr. Michael, do you want to just speak briefly, I think, to how we can safely interact with former COVID patients as we near the wrapping up of this session and end the question?
So, interaction with COVID patients that have finished quarantine is actually safe. Now, many patients go back and get retested and they are negative, so those are very safe. But otherwise, actually, after 14 days of self-quarantine or someone who has not displayed any symptoms for more than 2 days, they are safe. So they are not having any cough or fever. Those patients are actually very safe and interacting with them is safe. The one thing that is still not known anywhere from a COVID standpoint is at what point. So when you look at all various guidelines, they say isolate for 14 days. And if you go 48 hours without any symptoms, that person can come off isolation. Previously, there was some very strong recommendation after 14 days, get 2 negative tests. And then now that's kind of been rescinded quite a bit because there's been a thought that some people may have some low viral shedding and it can go on for a while. So the idea of retesting, they're backing off and off that. So, but once patients have no symptoms and they have finished their time of quarantine, they are very safe to interact with. But I will end that with saying that, yes, so take, for example, HIV. HIV is a typical disease where people measure viral loads and they say, oh, this person has undetectable viral load. They're basically not infectious. But we don't really know the viral load for COVID-19, at which point someone is just not infectious. But it's been mostly no symptoms, either 14 days of quarantine, or someone has had symptoms and they are 48 hours without symptoms. And when you look at many places, those people are being allowed to go back to work, whatever work they do. If they have tested negative, they are safe, yes.
So thank you very much, Dr. Michael. There were very many other questions that came in the chat room, but apologies, we will not take those because of time. And we know we have people among us that had more personal questions. Please reach out to Coach Purity or myself and we see how we can link you up directly to Dr. Michael. Do you have any parting words for us as we close this session, Dr. Michael and Wehamba?
Gladys, there's a question I wanted to ask Dr. Michael. Dr. Michael, you've handled so many COVID patients to date. People need to know, how have you been able to protect yourself for this long? Because we've heard about doctors who get the virus and some of them even have died. So how have you been able to keep it healthy and protect yourself?
So God's protection by far and by far and large, but it's been the progression of so the place that I serve in, most people, the highest risk part is when you're interacting with patients before you actually know that they are COVID positive. And so that makes a very high risk. Now, the place, and mostly in the US, was early along as COVID started spreading, there is a universal masking, wearing protective eye gear all the time. So that has been very useful, and maintaining frequent hand washing. Now, when dealing with the actual COVID patients whom I interact with on a regular basis, and some are usually very sick, they're on life support and different ways, it is now wearing much more protective gear, N95s, full gown, masks, and that's really what's been helpful in protecting against this disease. It seems if you have the proper protective equipment, it is safe. It does help limit how, the risk of infection. It doesn't reduce it to zero. I have had colleagues that have still gotten infected every so often, but I've tried as much as possible to maintain the protective, making sure that the personal protective equipment is worn at the right time and in the right way and taken off in the right way. The part that you can't control for is getting in contact with that person you thought was having something else. It wasn't COVID, it was just something else random, and yet they are actually asymptomatic, but they are infected. Those are the ones that are most likely to transmit the virus than anyone else. And so far, I have to say, God has really been good to me. I've been able to not get in contact with that as yet.
All right. Thank you so much. Gladys, can I take it on? Did you have another question?
No, I don't have any other questions.
All right. Well, this was so much to learn about, a lot to discover. But one thing, among the 4 treatments that he mentioned, there was boosting immune system. That one is very important. From my side, I think we can do a lot, because here in Uganda and most of the African countries, we have a lot of these fruits and vegetables that are freshly and organically, grown. So it's very easy for us to, at least we are at a greater advantage to see that we boost our immune system. Before I proceed to what I thought would conclude with, I request Mr. Wako, who is online, the chairman of KweraBITS, to move a vote of thanks to our guest speakers, and then we'll go on. Thank you.
Thank you so much. Good evening, ladies and gentlemen. All protocol observed. Indeed, the last 1 hour has been dissecting COVID-19. And many, if not all, will agree with me that we are at a better place than we were at 4 p.m. when we just started. On behalf of KweraBITS Limited and all the attendees of the November Health IMAPACT Bond meeting, and on my own behalf, I would like to extend a hearty vote of thanks to all the speakers, Coach Purity, Dr. Hilary, Mrs. Gladys Tugume, and most importantly, Dr. Michael Muzoora. You have done us great by your well-researched and insightful delivery, and we are greatly honored and humbled that despite your busy schedule, you have loved Uganda and shared with us from the overflow of your vast knowledge. Truthfully, as KweraBITS, we cannot exist without such partnerships. I would say you qualify us. When we work with people like you, it means we're actually interested in people's health. Asanteni sana, ndugu. Thank you so much.
Thank you very much, Mr. Wako, and everyone. Thank you, Purity. I really appreciate the opportunity to share with everyone, and for all of you taking time off your busy schedules to be part of this. Thank you very much.
Thank you so much, Dr. Michael. Thank you so much, Mr. Wako, Mrs. Gladys Tugume, Dr. Hilary, and everyone else. Like Dr. Michael said, also the people in attendance today, I know most of them, they are very, very, very busy people. But I think we have learned how to align our priorities, and we know that our health is #1. So thank you so much. I'll not take a lot of your time. I just, how I started this meeting, I told you that Health Impact Bond, we usually have challenges every month. We have something to improve our health. We have something to do in order to boost our immune system, exercises to do that I put out there. We have WhatsApp groups that help us follow up and give accountability. And we have partners that help us. We work with doctors. A number of my clients are doctors as well, and they're also on those forums. So we help each other to make sure that we stay in check. And we are more than grateful to have people like Dr. Michael partner with us this afternoon. We know this is not ending today, and we have been so impacted. Very, very, very impacted. This was such an eye-opener, and I'm sure we are going to be different. So much hope, but also, yeah, so much to learn, so much to learn. To all the Health Impact Bond members and KweraBITS members and the other people that have logged in, we are having the December challenge, and our December challenge is mostly to boost our immunity and for those that want to manage their weight. Dr. Michael and the new people that have logged in, 90% of our clients at KweraBITS are for weight management, weight loss. Most of our clients are overweight. And of course, this is attributed to, because of the sedentary lives that we are living, the way we are eating. It is sad, but it gets worse every other day. As people get more busy, then they forget about their lives. But we have been able to talk with these people to kickstart them into a lifestyle, because I believe it's a lifestyle. It's not a one-off thing. It's not a diet thing that you're just trying to do and stop in a week or a month. We adopt healthy habits and take it on for the rest of our lives. And of course, before you know it, what was so hard at the beginning is actually part of it, becomes a habit, and it sinks into your subconscious, and it is very easy to just live a normal good life and cut weight. So that is why the December challenge is mainly for weight loss and boosting immunity. We are going to do lots of smoothies. These are all well-researched meals. So we make sure that you have all the daily recommended intake of the nutrients that the body needs. But when you're taking in dense foods that are dense in nutrients, but low in calories. So it helps you to create a calorie deficit, but when you're feeding your body right, and of course the exercises. So we are going to be doing a lot of soups, a lot of juices and smoothies. I have sent out the plan already to the people who want to take it on. Please do not miss it on our forums. Thank you so much, everyone. Those of you who want to log out, you can find us in our inbox. Those of you who want to stay and we chat a little bit, please, you're more than welcome. We had a very good attendance of over, I think, we went to 68, 70 people. Right now we have about 57 in attendance. So that was really good. Even just one person touched and changed, it makes a huge difference. Of course, they'll go and tell others about it. If we ever have another meeting like this and we need to continue what we started, we will definitely take it on if we have that chance. And Dr. Michael can be gotten online also. You can search him up, get him and be able to, we'll give you information, me and Gladys, and you'll be able to have a one-on-one with him. Out of his busy schedule, he will be able to get you that time and you talk more, especially if you are already infected by COVID-19 or you have someone very, very close with a virus and you need help. Thank you so much, everyone. God bless you.